Healthcare is the most targeted sector when it comes to ransomware attacks.
That's why it's so important to be able to have these solutions, and it helps you actually determine if you can actually fix a problem sooner by addressing it and remediating it, or segmenting it and making sure you're isolating it so it can't get any further, rather than it propagating throughout your whole system.
Hi, everyone. My name is Sarah Fink, and I'm the Healthcare Principal PMM here at Citrix. And with me is Cletus Earle, our Field CTO for Healthcare at Citrix as well. And before that, a Health Systems CIO for decades. So today's conversation is about business resiliency. So it's really not about policy, but more about the architecture of business resiliency and how organizations that absorb disruption and recover fast make different decisions before an incident, not just during it. Cletus, I wanted to ask, what brought you to this topic? What makes it personal for you?
What makes this personal for me is going through it. Talk about a lived experience, and unfortunately, it's not if but when. But for me and several others like me, it's that it did happen. And going through a comprehensive cyber event, knowing that patients' lives are literally on the table. It was extremely important and evident after experiencing a major a cyber attack, knowing that we needed to create an ecosystem, a solution for our industry to be able to prepare and having better outcomes. So I wanted to do everything possible to prevent huge interruption and disruption, and potentially impact to the patients that we're serving.
Yeah, I can't wait to hear your stories. Let's get into it. Here's what we're going to talk about today. We'll first take a look at the threat landscape in healthcare, of course, specifically. Those numbers really matter. And then we'll go deeper on the structural problem. From there, we'll talk about that architectural shift that separates organizations that recover quickly from the ones that don't. And then we'll close with a case study to show how Citrix specifically delivers on this use case. Cleus, what's the one thing you want someone to walk away with today from this conversation?
The one thing that people should walk away is being prepared. So the key here is we don't have to sit and wait for a disaster, because we can make a difference by just doing the key steps in order to help remediate some of the challenges that we have regarding this topic.
Exactly. Well, let's get into the numbers. Healthcare is the most targeted sector when it comes to ransomware attacks. And last year, there were more than 460 attacks that were reported. And note that sometimes there are attacks that happen that actually don't get reported. And then this is the number that really stood out to me when I was doing some research here, is this 22 days average dwell time before detection, right? That really hit me hard. What does this actually feel like inside a health system when you're on the other side of these numbers, Cletus? And then what determines that difference between a 24-hour disruption and like a 3-week crisis?
The dwell time really refers to the amount of time a nefarious actor is actually in your network. So let's just imply that you were compromised, right? And there's many different ways of being compromised, whether it's the human factor, or there's a technological gateway for those actors to get into your system. Well, many times they just get in there and they sit and wait. They are actually bringing in, collecting data, understanding what's happening, and being able to see where your vulnerabilities are. So those 22 days is the amount of time a nefarious actor is sitting in your system and just watching and being observing, what's happening. What we can do during the 22 days is being able to use our technology that we have, like such as Uber Agent and other types of tools, to be able to monitor what's happening within your environment. But the key here is it's don't this monitoring needs to have an established baseline. And that baseline, why it's so important to put these products in place earlier, so that when somebody or this actor comes in your environment, our technology is able to understand patterns and realize when a pattern is actually being violated, or something different is occurring within your subsystem. So the technologies are able to then now be able to notify administrators or security experts to help identify, hey, there's a a variation occurring, and there's data that's moving this way where it shouldn't be doing that. That's why it's so important to be able to have these solutions in, and it helps you actually determine if you can actually fix a problem sooner by addressing it and remediating it, or segmenting it and making sure you're isolating it so it can't get any further, rather than it propagating throughout your whole system.
What it really gets at too is that the problem, like the slide says, is bigger than just cybersecurity, right? It's not just compiling a bunch of different security tools on an endpoint that ultimately fixes the problem. But we also want to make sure that we're talking about the right structure and the right architecture to protect an organization, and make that threat more manageable. So let's talk about some of those layers of structural exposure. There's unpatched medical devices, fragmented M&A, and distributed care. And there's, of course, more. And they don't just coexist, right? They compound on each other. So, Cletus, when you've walked into a new health system, what did that actual attack surface look like? And what surprised you?
Yeah, the attack surface is vast. Usually, new CIOs or even existing, you're doing assessments, and the key here is those attack vectors always tend to increase over time, because as more and more tools are offered and introduced, the complexities increase. So there is the traditional items that we have to look at. We have a whole slew of technology, such as medical devices, that are biomedical devices. See, 60% of the devices are end of life. We know this as a huge gap for us. And because many of those devices are end of life, they have inherently huge amount of gaping holes when it comes to security, and they are a huge threat to us. When you mention mergers and acquisitions, whether we're buying new hospitals or new locations or businesses, we inherit sometimes legacy holes, and those legacy holes are really challenging to us as an organization. When we're divesting, sometimes, right, we're also pushing through things. So think about it, Sarah. Think about it this way: sometimes when we're purchasing a new business, a new hospital system, they may have age infrastructure. In many cases, they're being purchased for a reason, right? They probably didn't have the dollars to invest in their infrastructure for years, and the new business is taking it over, and it's the expectations that we're going to bring it in, and bring them up to speed or up to date on their infrastructure. But it's nearly impossible to do that day one. So you're absorbing the cybersecurity risk that's actually at these organizations. And while that's happening, it creates a huge attack vector for us. Some organizations, even some local businesses that you may have under your span of control, are not necessarily all up to speed when it comes to the hardening of their environment or infrastructure. And the last big thing that I think is extremely important to think about is the biggest challenge that we have when it comes to uh, attack vectors or threats, is the human capital component, right? The human element. For the most part, people, they'll click on the wrong link on the internet, or they have a particular email or a smishing a SMS message that they click, and they compromise our environment because they're in our environment. And these are the type of things where it's always a challenge. But when it comes to the architectural side, there may be some gaps as well. As a new CIO, I realized that some of my teams, because we're doing all of these other things, such as mergers and acquisitions, and keeping the lights on, all of those things, they're not being brought up to speed on how they can keep their systems, their infrastructure optimized. So therefore, it's creating all these gaps. So the more we grow as an industry, as a business, the more risk that's being offered. And let's not forget the latest, biggest risk that we have now, which is the AI element, right? AI, from a cybersecurity perspective, is very troubling. And if we're not putting the proper controls in place, we may be putting our patient data at risk. So there are a bunch of things we need to consider.
I'm so glad you said that. I mean, the 2 things that you added to this slide, which I think I just wanna kinda double click on is right, that human element I think is really big and ongoing, right? It's not just like a new technology coming on the market that increases that attack surface. It's really just there's new people coming and going in varying levels of sophistication and understanding of the technologies that they're managing, and and the workarounds they might be using too to get their jobs done, right? That's just normal. But then AI, and I think that, that while this is not about, this conversation is not specifically about artificial intelligence, it's on everybody's mind. How do we manage it? How do we keep people safe? How do we keep data safe? Um, and that's not going to change either. And we're going to kind of transition now into some of those architectural conversations more specifically, but I wanted to make sure that we had a really strong understanding of kind of all of the different situations that we're managing right now, so that we can, have a really open conversation around some of these strategic decisions that maybe folks are not making. Leaders are stretched thin, right? They're just trying to keep the lights on. That's where I'd love to spend a little bit more time, because it's not just about budget or staffing. It really is strategy. It happens at the leadership level. It's planned out through multiple years in investment. So you've been on both sides of that. So how is this architectural decision so important, and why it's more strategic than tactical?
Yeah, I think it's the big difference between success and failure. Why you see such a short amount of tenure for CIOs and CISOs that are out there, because making the wrong decision puts you in a situation where you put your organization at a significant amount of risk, and you have enough runway to remediate. If you're not doing that, it can cause you your job, and more importantly, it's causing a vulnerability to the patients that you're serving. So I think this is key here, to understand the various nuances of the architectural decisions.
First off is gonna be that application session isolation and some of the elements that go along with that. Um, Cletus, can you kinda take us through what each of these are, and how it kind of feeds into this overall session isolation and the power of that? This first one being, managing that endpoint.
Yeah, the key here is one of your biggest, risk factors is the endpoint. When you have data residing on a physical device, that physical device being a primary target, right? Many organizations, you see, they take the USBs, if there's a device with a USB, and they, believe it or not, they crazy glue some of the USB, so it prevents from people putting things into the port and having some kind of attack vector there. So being able to make the endpoint, reducing the risk of having that computer, laptop, or anything store data, whether it's your PHI or anything else, is key. The second part is data never touches the device. By having that structure, right, not making the endpoint have information, and just making it we call it an IO, input-output device, it allows us to be able to mitigate how many threat points there are. We talked about the dwell time that's there. Well, guess what? If you remove some of the devices, in some cases, organizations may have 20, 30, 40,000 different computers. If you remove that from being part of your attack vector, you help mitigate the amount of risk you have. So again, the key here is trying to get off of the concept of having these devices store information so that data doesn't touch it. And understanding that a compromised endpoint cannot reach the application layer is absolutely key. So the other element is to isolate, right? Making sure that when you do have a scenario, I mentioned the IoT, I mentioned the medical devices, if they are actually compromised in the event, the key here is to help isolate those things. And we do that with network segmentation, right? We're able to segment our infrastructure so that what and when and if something happens, it's isolated, right? It's we containerize it. So the key here is to have a infrastructure set up so that you can actually help, and you do that by doing a comprehensive isolation model or a segmentation. And again, you have a macro segmentation and a micro segmentation. Macro at the bigger space, right, when you're dealing with servers and a lot of other things, switches, but then the micro level where you're able to segment the endpoint itself. And if we get to a point where we're able to do comprehensive micro segmentation, then we're really preventing east-west traffic, which means preventing a nefarious actor from being on one system, one computer, hopping to the next, right? Or hopping to different types of systems. So the key here is containerizing it, and you do that by isolation. And that's the key from network segmentation.
Yeah, I love that, and I think that, that really gets at, why a centralized environment is really gonna be the simplest way to manage all of these different devices, and again, back to that attack surface. So how would you explain this to a CISO who's used to thinking about security?
Well, I think it's key for us to have those discussions at the strategic level first and foremost, right? To be able to say, like Citrix, we are partners. We want to work with you. We want to help you understand what your environment is, understand what technologies we have, and being able to help you mitigate those risks. So, as an example, I think one of the first things is understanding personas, right? Being able to manage personas, being able to identify that a nurse has a different workflow than a doctor, that has a different workflow than um, a IT person, and all of the other different titles and responsibilities in between. So being able to help the CISO to understand, once we're able to map out personas and understand the various nuances between each user, then you're able to, identify that at the Active Directory side, have that propagate, and then have a true identity management solution that's going to really work for you. And while we then have this identity management mapped out based on personas, then we're able to then execute the technology to help navigate all of those identities in the respective areas they should be working in. And then we have some other products that really the persona based mapping helps us out with certain solutions like Flex, and that's a further discussion. But this is why it's so important to kind of do these things at the baseline.
I love it, and you really just teed up the next part because I think making this practical is so key, and when you think about who's using these technologies, right? They're just not different endpoints necessarily, right? They're workers, they're admins, they're nurses, there may be janitors, right? Everybody's sort of touching the technology in a different way. You may have a clinical research facility inside your organization. Let's walk through some of these personas. So those scenarios just become more like real life rather than just looking at a device and inventorying it as a number, right? Because not all personas are treated the same. Um, the first one I love to call out is that bedside nurse, right? Because we're always thinking about their experience with our technology, right? Clinician satisfaction is the number one priority in any of these technologies, especially when we're making infrastructure decisions. Centralized delivery of EHR applications is sometimes not always seen as the best experience for that bedside nurse. I'm wondering if you could share more on that front.
So I think the dynamic here is understanding that the bedside nurse, right, is key. As you think about the bedside nurse, whether they're in the ED or they're on the floors, an ICU nurse, everybody has a different workflow associated. So many times they tap and go, or they smooth roaming. They move from desktop to desktop, room to room, whether they have a workstation on wheel or they have a device that's actually in the room. There's a different type of workflow that they do. They may be prescribing medications that needs a different type of persona based on it, compared to if you're out of the hospital, like a visiting nurse space, has a different type of workflow. So it's very important to think about how personas are different even within this subgroup, right? So nurses have different perspectives. The same thing applies to our doctors. In this case, we're talking about radiology, right? Remote radiologists may have a different workflow than a traditional ICU physician or a ED physician, or it's these things that we have to think about, that everybody uses this system somewhat in a unique manner. And because somebody may be sitting in front of a computer like a radiologist all the time, right? Don't get up. They're just in their reading rooms. They stay there. That is completely different than a doctor that may be in the ED. So understanding the various workflows are important, and it's key to translate that into a technology workflow. And it doesn't stop with the IT leaders or IT resources as well. So during an IT, incident, security incident, you need to have different credentials in these same ways, where a persona-based approach and the practice is very nuanced. So the key here is being able to have and identify all of these different workflows, knowing that each workflow may have a different pull down when it comes to technology need, and then we are able to create restrictions associated to that and containerize it just from even a credentials perspective. But then when it comes to technology, being able to allow those workflows to operate in different manners.
I love that, and right, because it's not a one size fits all, and that's when we're thinking about a centralized infrastructure, we're able to really assign those different capacities, the different workloads to these different personas, and the organization stays resilient through that, right? Understanding those personas. So these are complex ideas, but the idea at the end of the day, right? The hope at the end of the day is that we're actually making it simpler, so that the organizations don't actually have to think about all of these different elements because we put it all in one place. So, we're going to transition now into how Citrix helps, right? And this is really where that strategic conversation and that board conversation comes into play. It then becomes about impact, right? And so how does this architectural decision, right, this persona-based approach make to change the game when it comes to resiliency? So you go from weeks to, cutting that time in half. And I'm wondering if, Cletus, you can share with us, what that without scenario looks like. What are some of the things that are happening in a cyber incident when you don't have that centralized architecture?
Yeah, so going to through the without as an example for the unprepared, unfortunately, and when you get compromised, one of the first things you need to do is notify the FBI, right, and the other local authorities to be able to determine exactly what to do. Because particularly in many cases, it's a malware attack or something that's happening where you're unfortunately need to make a decision: are you going to pay the malware, or are you going to remediate? And either way, as those decisions are being made, it takes a while. If we decided that we weren't going to pay and we were going to have to remediate individually, we would have to go around to every workstation, every computer, every server, almost all switches, and be able to try to remediate the technology, whether it's wiping it clean and being able to start over. And you have to have your back office see all of the things, the technologies to be able to accommodate that. And that can take weeks. People have to go remove the devices from the floors, bringing them to a center, a centralized location, be able to then wipe those devices. It doesn't can't wipe them immediately, right? You have to do your DoD type of wipe and then be able to start off if you're not buying new technology. So you're talking about hours and hours for one device, and then you have dozens and dozens and dozens of devices happening at the same time. So as you can imagine, it's a very arduous task to do that, and it's taxing to not only from a technology side, but that's doing it on a continuous basis. So you need resources, you need boots, right? You need people that are going to be doing all of that work. And that's the without, right? Without planning, without having the right architecture in place, you are putting yourselves in a position. I know there's some EMR companies out there, right? They're pushing hard to go local, right? I think that yeah, it may to them it may make sense to go local because you're trying to have some efficiencies and speed. But what's not happening, right? We are also able to create speed, but again, we have to meet with each other and really architect it right. But it's not only the speed that needs to be addressed, it's those other type of outcomes, right? Such as how long will it take to recover? And what we've seen when you do plan and you do work with us and you're using our technology, the Citrix technology, we've been able to recover systems within days, right? Not weeks. And our thought process, if we even work even more collaboratively, right? we can do that within hours so that we can actually plan out the best solution for you so that you're actually getting the right turnaround time when it comes to resiliency.
That's huge, and I jumped ahead a little bit, but I wanted to get it to these kind of these outcomes because you were already talking about it. You know, we wanna be able to put ourselves in the position to help our customers, make these decisions earlier, right? And that's really what this is all about. So, right, this first one is, you know, limiting that blast radius, that containment, I think is key, and you touched on that, right? The next one is going to be that, you know, you're really not sacrificing the care environment at all, and I think that's a myth that we wanna dispel, that centralized, infrastructure actually really creates a secure but also frictionless access for your providers, so we don't want you to necessarily feel like that there's a trade-off. Because clinician satisfaction is so important that you need to move to everything to the endpoint, you can have your cake and eat it too, which is what I've been saying a lot lately. You can get both. And then finally that recovery and that board accountability, right? The metrics are there, the data is there, and there's a lot of opportunity to actually improve on what you have today and even get more life out of the devices that you already have today. I mean, there's a whole cost side of this as well that we really didn't touch on. For the CIOs that are listening today, that are thinking about making this shift, what's the first conversation they need to have inside their organizations, Cletus, to to maybe change the hearts and minds of how EHRs can be delivered, or really any application can be delivered? What would be the first thing that they need to do?
The first thing they need to do is have a discussion internally and what type of appetite there is to downtime, right? That's a governance conversation to have happen at the organization level, particularly with the executive and board. I really suggest that you start having these dialogues with, companies like Citrix and being able to map out what the art of the possible is and how we can leverage your own technology to get you up and running in the fastest way possible. I think that's probably the biggest takeaway here is, did you have that discussion at the organization level? Then you need to be able to start having the discussions with companies like Citrix and being able to map things out.
That's great. Yeah, let's review those key takeaways and then wrap it up. So I think we talked about, you know, resiliency being an architectural decision and not just a security program, right? So it's about bringing all the right people in the room and really understanding the different elements that affect the ability to bounce back, right? When, not if, something happens to the organization. The next one is that attack surface and the growth of that attack surface. M&A really creates a lot of fragmentation, and M&A is just constant these days in the healthcare industry. So speed and access, you can kind of have it all, I think, is what a centralized infrastructure helps because it actually does speed up that access as well. I loved what you said about session isolation, network segmentation. Any final thoughts on that one?
Yeah, I think, it is imperative. We mentioned a couple of things, but you did talk about academic medicine, understanding that health systems, depending on what type, and particularly if it's a AMC, they require, different types of access, and network segmentation is key.
And then this last one, which is also going to be, at least for me, is really more about how you elevate some of these IT decisions into being more strategic board conversations.
So it's going to be imperative that you're not just thinking about this as a financial hit, because you're talking about the amount of days an organization stays down is the millions, tens of millions of dollars they lose on a daily basis. So, keep these things in mind, because this can actually be the reason and the rationale of getting some of the investments really prioritized at the board level.
Of course, we want to make sure that if you have any questions that you're looking to get responses to, that you know that we're available to do that. So check out our website. There really is a lot of great additional content there about business resiliency. If you'd like us to do an assessment, we'd love to do that. There is a really great article around resiliency by design, which is both on the Chime website and will also be published on citrix.com. Thanks everyone for joining us today. See you next time.
Thank you. Take care.